Well, good afternoon and welcome to everyone to the AgrAbility webinar series. We certainly hope it's warmer wherever you are than it is here in West Lafayette, Indiana, but we realize that many people are experiencing the chill also. My name is Paul Jones and I'm the manager of the National AgrAbility Project that is housed here at Purdue University. Today's topic is on arthritis pain management, and our presenter is Amber Wolf, who is the AgrAbility Project Coordinator for the Arthritis Foundation Heartland region. Before we start our actual presentation, just a few basic instructions. You will need speakers or headphones. We're not using a phone, so hopefully you are hearing me give that instruction. You can check your sound if you're having any issues through the audio setup wizard under the meeting menu that's at the top left of your screen. If you have any questions about the presentation itself, you're welcome to either type those into the chat window, which is under the video, and hit the little bubble icon to send those, or at the end, if you have a microphone on your computer, you can raise your hand and we will attempt to connect you so that you can ask your questions verbally. We have 4 quick poll questions at the end, so please stick around and give us some feedback about the session. The recording for this webinar will be archived at the website listed on your screen, and you're welcome to go ahead and click that, open that link and bookmark it if you would like. There are already handouts and resources that Amber is planning to talk about listed on that website. We have several today, so please make sure that you refer to that site at some point. Any technical problems during the session, please try to use the chat window if you're able to. If not, you can email agrability@agrability.org, and we'll be monitoring that email account during the presentation. If you are having echo, it may mean that you're logged in twice. So please make sure you're logged out one of those times. If our presenter gets disconnected, please just hang on and we will reconnect as quickly as possible. And if you are disconnected for some reason as a participant, please just try logging on again. For those that are not familiar with AgrAbility, we're sponsored by the U.S. Department of Agriculture, and our goal is to assist agricultural workers that have some type of disability, including arthritis. Every AgrAbility project is a partnership between a land-grant university and at least one disability services organization. Right now there are 20 state projects around the country, and there is one national AgrAbility project. Again, that's led by the Breaking New Ground Resource Center at Purdue, and our partners on that project include Goodwill of the Finger Lakes, the Arthritis Foundation Heartland Region, University of Illinois at Urbana-Champaign, and Colorado State University. If you'd like to find out if your state has an AgrAbility project or just more information, you can visit us at agrability.org, and there are a lot of resources related to various types of disability and various types of agricultural enterprises. At this point, I'm going to turn things over to Amber. And again, she has been with our project since 2009 and does a variety of activities related to arthritis and agriculture, including resource development and regional workshops around the country. And at the end, I will come back for our question and answer period and for our poll questions. But now I will turn it over to Amber.
Thank you very much, Paul. I hope everyone can hear me. If not, please let us know in that chat window and we'll get that rectified as soon as possible. Thank you for joining us today for our webinar on arthritis pain management. We have done several webinars in the past on other topics related to arthritis that will explain more about the basic signs and symptoms. So if you have additional questions about that, please see that website and look at those archived presentations. For today, we're going to focus on pain management and why does arthritis hurt? Pain is the body's natural way of letting you know that something is not right in your systems or in your joints. And with arthritis, that pain can often be very difficult to live with. Just like there's several forms of arthritis, there's also different forms of pain. And one thing to remember throughout this presentation is that everyone's pain levels are different. Everyone's medications are going to be different. Everyone's management strategies are going to be different. So please make sure you know that these are just simply suggestions, and some of these suggestions will need to be spoken about with a doctor or a healthcare physician before you attempt any of these pain management techniques. We're going to get started today talking a little bit about what to do and how to find out if you have arthritis and how to get a proper diagnosis. The first thing I would suggest is always talking to a healthcare professional. It's very easy at times to assume you have arthritis or to talk to someone who thinks you do, but finding out exactly what form of arthritis is ailing you is very important in deciding what type of pain management techniques you might use. The things that are going to happen when you do go in to see a healthcare professional is that you're going to provide them with a symptom history, talking to them about what type of pain you've had, how long you've had that pain, and what your limitations are in your daily routines. They're also going to want to do a physical examination to look for any stiffness or swelling or heat in your joints, potentially do an x-ray if they think there are some issues to determine the extent of the damage in your joints, and maybe even blood or urine tests if they're looking at other type of autoimmune diseases that would be relative to arthritis as well. You can see an example of a pain chart that might be used at one of these physician visits, and this would allow you to show them on a scale where the pain is affecting you in your joints and how it's affecting your day. The link to this resource is also available on the archive website with this presentation, so if that's something that might be useful to you, please go to that website and download this link as well. When you are visiting with your doctor, make sure you're honest with them. Sometimes it's very easy to gloss over the pain or think that you should be able to handle the pain on your own without complaining about it or without going to talk to a doctor necessarily if you don't think it's that bad. However, again, everyone's pain is different, so even if you have a small amount of pain, it could still potentially affect your daily life. So make sure you tell them how much pain you're having. Talk to them about how often it's affecting you, specifically localized areas on your body where you have the most pain and what those symptoms are, but then also be open to their suggestions. Pain management and pain control is very individualized, so you have to be open to trying maybe a new supplement or trying a topical type of ointment before moving into some of the more medical aspects of pain control. Make sure you're willing to work with your doctor on your management plan and know that that plan might adapt several times over the years before you find a method that really is going to work for you specifically. Some warning signs. How do you know when to go see your healthcare provider? First off is pain. And again, pain is different for every person, but if you are starting to feel even a slight twinge in a certain joint or even a full-fledged amount of pain that really is letting you know that there's something wrong in that part of your body, that should be your number one indicator. However, if you also notice some swelling around a certain joint or stiffness in those joints, you'll also start to notice that you have difficulty performing tasks. So if you start to notice that for a period of time, it's difficult now to reach a tool on a top shelf in your barn, or it's difficult to bend down to pick up something out in your machine shed, you'll start to notice that you're having difficulties doing the same tasks that used to be easy for you. Those type of indicators generally tell you that that's a warning sign that you might need to have those joints checked out by a physician. A little bit about the common types of arthritis that might be brought to your attention when you do talk to your physician. The first thing they're going to explain to you is that arthritis is just very simply the inflammation of a joint, and that can be any joint in your body. At times, some people will have just one joint that might be injured or stressed or strained, and there's other forms of arthritis that might affect several joints in the body at once. Again, that's why it's very important to have that proper diagnosis so you know exactly what type of arthritis that you're working with, because that pain management technique is going to be different from osteoarthritis to rheumatoid arthritis, fibromyalgia, gout, and lupus. They all are going to have a different technique. Osteoarthritis and rheumatoid arthritis are the two most common forms in the United States today, so those are the two that we are going to talk about in most of our examples, with osteoarthritis tending to come to the forefront, just simply because it's that wear and tear degeneration that we do see most often in agriculture. Now, there's over 100 related different forms of arthritis, so if there is one that you have a specific question about, please don't hesitate to click on one of the linked resources at the end of the presentation or ask about it in the chat window today. Rheumatoid arthritis is a form that several people are familiar with because it tends to be very visible at times as well. It's a common form that affects around 1.3 million Americans in the United States today. It does tend to affect women more often than men, but men can be afflicted by this form of arthritis as well. With rheumatoid arthritis, you can see in this image that it's actually an issue that's related to the inflamed synovium or the synovial fluid in the joints. And what's happening is as this is persisting throughout your joints, not only will it cause the same stiffness or pain that osteoarthritis would, you're also going to have a lot of heat that's going to go along with it. You're going to notice a warmth in the joint as well. That's because this is an autoimmune form of arthritis that is attacking the body from the inside out. This is a form that's going to require a little bit more of an intensive medical treatment than the osteoarthritis will. With the picture of osteoarthritis, you can see that this is just the degeneration of cartilage. This is the breakdown and destruction of a joint, maybe due to overuse or stress or injury. And this is the most common form, with 27 million Americans being affected with osteoarthritis today. Because of the overuse of joints in many of our agriculturalists, this tends to be the most common form that we have questions about. So we're going to use this as our example for most of our information today. So why arthritis hurts? What is it doing in your body? What's happening is that there's a physical inflammation of the joint tissues in and around any of the joints in your body. That inflammation then is causing pain. It's causing the nerves to send a pain signal to the brain. What's also happening is that you're adding stress to that damaged joint, also causing that inflammation and pain. Anytime you bend or move the joint that's afflicted, or anytime you're stressed or strained or even fatigued, you're going to notice a higher level of pain related to your arthritis. There's two main causes or two main types of pain that we'll talk about today. Acute pain is short-term, something that's often related more to an immediate injury. Perhaps you were working in your feedlot and you slipped and fell and landed on your knee. Or maybe you were out even just simply walking to your mailbox and you fell. A more acute injury is something that can be handled immediately, whereas the chronic type of long-lasting pain with arthritis is something that's recurring. And you'll start to notice that after that 2-week window where you notice you've had those difficulties, it's going to continue. Now, there might be times and periods of relapse. With osteoarthritis, you might not have pain 24 hours a day, but you will notice that it eventually will start to come back with certain triggers. Maybe triggers in what you're doing or your activities. Sometimes even diet can trigger those acts of pain as well. So what happens if you have pain? How is it going to affect your body? The first thing we have to realize is that when you have pain, many people's natural inclination is to stop what they're doing. If the theory is that if you stop doing what you're actively involved in, then you're going to stop the pain that's involved. And that's not necessarily true with arthritis. Because it's the joints in your body involved, it's still going to have the inflammation present that's going to be causing your pain. So you're going to also notice that with that, you'll probably have a loss of muscle strength and a decrease in your mobility because that natural inclination is to stop. That's not always the best option for pain management, and we'll talk about physical activity in a few of the next slides. However, with pain, you'll also start to notice a few things like having a poor quality of sleep because your joints are stressed and strained before you go to bed and they haven't had a proper amount of time to regenerate and rejuvenate themselves. You'll also notice that there might be some instances of isolation or depression because pain tends to affect the overall quality of life. Most people don't enjoy pushing through the pain to go out and continue their everyday activities or their social activities or their community obligations. So you'll start to see people withdraw a little bit because that pain does tend to start taking over their life. And we're hoping that that's not going to happen. We hope that this presentation today will give you options for managing that pain so you can continue to have the quality of life that each of you deserve. However, some people don't put pain in its place. There are issues with either trusting medical professionals. There are some issues with pride and just thinking that you have to be able to work through the pain and maybe not complain about it because there are instances out there that could be much worse for you. However, any instance of pain needs to be taken care of at any level. Some people, however, do believe that pain is just a part of getting older. It's not a natural part of aging. You shouldn't have to experience pain just because you're aging in life. There are some people who have made it to many, many years of age and never had any arthritis pain at all, and that's fantastic. But if you do start to notice arthritis pain at any stage in life, it needs to be handled. It doesn't need to just be accepted. There's also a general belief that nothing can be done for the pain, and that also is incorrect. Perhaps you're not comfortable with the medications or the potential side effects, but there are several other natural forms of pain management that we'll talk about today that will be able to help you manage your pain. We're not going to say that we can fully take away all of your pain, as again, everyone is different, but we're going to attempt to help you at least manage what is happening to you. There's also a fear that the activity is going to make that arthritis pain worse. Again, most people want to just stop and stop what they're doing and sit when they have arthritis pain. And again, that's not going to work because what's happening is then the joints are underused. The muscles and the tendons and the ligaments weaken, and then when you do go to move and work, then it's actually going to cause you more pain because those joints are going to stiffen up. So you want to stay as active as possible. Don't let those fears about taking care of your pain take over. Make sure you get out there and find a way that you can manage it yourself. So what's the best way to beat pain? Can we stop it before it starts? With osteoarthritis, absolutely. Osteoarthritis is a preventable form of arthritis. There's differences that we've talked about on former webinars on ergonomics and how to work smarter, not harder, using assistive technologies. And some of those same themes come into play in this webinar as well. So things that you can do before the pain starts, or even after the pain starts as well. Pacing yourself, making sure that your activities are not stressing your body to the point that that limit has been reached for your pain threshold. Switch between tasks. If you have to work on a task that's very physical, maybe lifting and carrying heavy things, take a break and take a 5-minute break and then move to an easier task where you're using a different set of muscles. If you're using your shoulders and your upper back for most of the morning, try to switch to a job that might allow you to sit for the rest of the day and maybe work from a sitting position or use a different part of your body as well. Plan those rest breaks throughout the day. And in agriculture, I know this is very difficult to take breaks. Our natural inclination is to just push through and work from sun up till sundown, especially at harvest and planting times. But we need to make sure that you're taking those active breaks throughout the day. Even a short 5-minute break will allow your joints to rejuvenate, give them a chance to relax, and that's going to help you control your pain throughout the rest of the day. Some people might need a longer 15-minute break, but again, that's something that you're going to have to work into your own schedule to make sure it's working for you. Recognize when you need to rest. Everyone has a different limit of when their body has reached that point of needing to rest. For some, maybe there's only a 30-minute period of activity before they need a break. Others may be able to work 4 to 6 hours before they need that break. But you personally need to know when have you reached your limit and pay attention to that. Don't give yourself an extension of only 5 more minutes. Make sure you stop when you need to stop. And don't overdo it. It's very easy to say, I have to get these jobs done today because I have to move on to something else tomorrow. But if your body is physically in pain, don't allow those tasks to take over. Make sure you're paying attention to your body first. Things that you can do to protect your joints before the pain starts. Avoid certain activities that you know are going to stress your joints. So for example, if you need to be moving several bags of feed in one day, you know that the best idea is not going to be to physically carry them. Make preparations to have a small 2-wheel hand cart or a dolly to move that feed. Find a way to avoid using your own body and using those joints to the point that they're stressed. If there's no option for that and you have to get through that job, then again, take that step back, pace yourself, take your time to do that, and make sure you're using the largest joints possible. Anytime you're carrying or hauling something, try to keep it as close to your body in those larger joints. It will help prevent the stress on the smaller joints at the ends of your arms and your ankles. Use splints and assistive devices if necessary. If there is an option for you to use a tool to accomplish a job, it might take an extra step to get that tool set up, but it's going to help in the long run by taking away the pressure or the vibration or any of the stress and strain on your joints. And knowing how to use your joints properly. We've all known for years that we lift with our legs, not with our back, but taking the time to actively do that and working your body properly is going to go a long way in protecting your joints. Practicing good posture is also very important. Several of us might spend hours at a desk chair or in a vehicle driving or in a tractor or in a grain truck, and it's very easy to get comfortable and relax and slouch in our seats. But poor posture goes a long way towards adding a lot of extra pain to your body, especially in your lower back, your shoulders, and your hip area. Find a way to aid that. Maybe it's just with a small support, or maybe it's a brace or an ergonomic seat. Finding some way to make sure that you have proper posture with your feet in the right position, your back sitting up straight, and your shoulders level with your hips. That will help a lot with pain management. Weight control is also something else that we can do in advance to help protect our joints and take away that pain or prevent the pain. Weight control is not something that anybody ever wants to think about. We all don't want to think about dieting and exercising, but it's a very important part of overall health control. And even a little bit of weight loss can help tremendously with arthritis pain, specifically in those weight-bearing joints of the knees, the ankles, and the hips. Those are carrying all of the weight of your body, plus the weight of any task that you might be accomplishing. So even a 1 pound loss of weight can take as much as 4 pounds of pressure off of your knees. So if we think about that in mathematical terms, anytime you're carrying an extra 10 or 20 pounds, that's also adding and compounding to the pressure on your knees. Taking away that weight, whether it's through the physical task or on your own body, is going to help. However, you have to be careful. We don't want anyone making sudden drastic diet changes to try to lose weight. We want it to be a careful loss of weight, something that's going to help reduce your pain and improve your overall function. With light physical activity, a healthy diet, and avoiding high sugars and high fatty foods, that's going to give you the best success for overall weight loss. And that's a very simple process. It doesn't require joining a gym. It doesn't require going out and hiring a personal trainer, but just simply speaking with your physician and finding the best method for you to maybe alter your diet or add a little bit of physical activity into your day. And that physical activity is very important. Movement really is the best medicine for all forms of arthritis. We don't want you sitting around and letting your joints getting stiff and painful because you're not getting up and moving. But we do understand that sometimes that isn't always the best option for everyone. So any activity is better than no activity at all. Even if you are able to start walking to the mailbox instead of driving, or if you're able to get out and just lift a couple of really small, weights, or even something in your kitchen that has a nice weight to it, just to get your circulation up and get your heart pumping, any activity is better than none at all. It's going to allow you to build your strength up, increase your endurance, and definitely maintain your flexibility in those joints. The more flexible and the stronger your joints are, the less amount of pain you're going to have from arthritis. So talk to your doctor. What types of activities might be best for you? They will be able to sit down and tell you what your limitations are. Based on that first initial appointment you had that might have had x-rays or a physical examination, they'll be able to tell you if walking is your best option or if you should avoid lifting any certain weights. There are several different options that you can do to increase the physical activity in your day. We're not going to suggest that everyone go out and join a gym to have access to a pool, but there's certain options out there with aquatics programs as well, and we'll talk about some of those. For the greatest benefit, what we would suggest you try to do to add into your own personal daily routine or weekly routine is work your way up slowly to about 30 minutes of aerobic activity, 50 minutes a week. And again, that can just be easy walking or movement around the house. Strengthening exercises up to 2 to 3 times a week. Strengthening those joints again is going to give you a better range of motion and more flexibility. Some very easy, simple stretches can be incorporated into anyone's day, and we have some examples of those on the next few slides. So one example of a way that you can be physically active is through the Arthritis Foundation's Programs for Better Living. This is a 4-part series that includes an aquatics program, a Walking with Ease program, an exercise or land-based exercise program, and even Tai Chi for balance and flexibility. Now, we're not suggesting that everyone go out and join any or all of these, but just simply knowing that these are the types of things that we would suggest for you if you are going to try to incorporate more exercise into your routine. The aquatics is especially good for anyone who might still be a little bit overweight that wants the buoyancy of the water. The warmth of the water goes a long way towards helping to relieve the joint pain caused by arthritis. The Walking with Ease program is also a very, very popular program just because it simply gives you that option to exercise without adding a lot to your day. There's also some options for DESKERCISE. Several of us, I'm sure, sit at a chair several hours a day, or like I said, maybe we're sitting in a vehicle. Right now it's harvest season in Indiana before the snow hit, so we've had people sitting in trucks for hours waiting in line at the grain elevators, and it's very easy for your joints to get stiff and for your lower back to start hurting. There are some very simple exercises that you can do while you're seated, whether it's in a desk chair or in a recliner at home in front of the television. And these are very simple, easy sets of stretches that can happen in under 2 minutes that don't require any extra tools or for you to go out and buy any sets of weights. They're just things that you can easily do to help you stretch and get flexible a little bit better. There are some tips listed on the right side of your slide here that you'll notice. If you are going to try to accomplish some of these, make sure you have the proper chair. Doing these in a big hard or a big heavy recliner where you're laying back and you're kind of enveloped in the nice big fluffy chair is not the best option. Find a nice ergonomic desk chair or even a straight-backed wooden chair that's going to give you the support that you need to do these type of exercises is going to help tremendously. So this next slide gives us some images of these DESKERCISEs, and we have attached this link as well onto the archived website so you can see this entire article. The article also includes individual instructions for each of these exercises. So you'll see that I've included here the trunk twist or the heel slide. These are just simply the images, and the instructions for those would be found on this resource. But for example, the trunk twist would be a great exercise for lower back pain or hip pain or even shoulder pain after you've been sitting for a solid amount of time. Very simple and easy to do. You don't even have to get up, and you don't have to have any additional tools. The heel slide is another one that's great for stretching your lower leg, extending the joints and helping with flexibility in your ankle and your knee, and even all the way up into your hip joints depending on how far you can bring your leg up and take it back down. Again, very simple and easy to do while you're seated. Other things that you can do to help prevent the pain is get a good night's sleep. And we know, and we have known for years, that everyone needs to get a good night's sleep to be well rested and ready to conquer the next day. However, for some of us, that's not always an option. Maybe our hours are different at work. Maybe we work in an industry with livestock where there's emergencies in the middle of the night. You just don't always get that same amount of sleep that you think you need. So it's very important that whenever you can get a good solid night's sleep, you take advantage of that. Because by getting a good night's sleep, it's going to allow your joints to rejuvenate and to be healthy and stress-free by the next morning. So when you go to get out of bed, you won't have that stiffness or that swelling or pain that generally is there in the mornings when you wake up. A few ways to do this to improve your sleep is one, a little bit of physical activity before bed in the evening. If you are going to add in some of these stretches, perhaps you do them right before you go to bed at night to stretch and allow yourself to relax at the end of the day and get ready for a good night's sleep. Avoiding alcohol and caffeine late in the evening is also key because those two things do tend to trigger more arthritis pain to start happening in your joints, especially later in the evening. Setting a sleep schedule and sticking to it is very important, and this is probably the hardest part. It would be great if we could all say we are going to go to bed at exactly 10 o'clock every evening and get up at 6 o'clock every morning, but we know that's not the reality of it. But if you can find the times that you generally sleep the best and try to stick to a schedule, you'll notice that your body starts to get into a routine, and you're going to start feeling better as you get into that sleep schedule. Taking a warm bath before bed, or even using something like a heating pad or an electric blanket. Anytime that you can warm up your joints, it's going to help with that pain. It's going to help relieve the pain. But you do want to be careful because if there is an instance of rheumatoid arthritis where there's already heat in the joints, you don't want to apply more heat to those. So again, that's why it's very important that you do look into an accurate diagnosis of what type of arthritis you have because managing that pain is different. Trying to avoid stress and allowing your mind to relax at the end of the day is also very important for a good night's sleep. And again, this can be very difficult for some of us in agriculture because we're lining up the activities for the next day. We're worried about maybe something that's already happening on the farm or in our business. But finding a way to just take a little bit of time to relax your mind and de-stress at the end of the day will help tremendously towards allowing you to get a better night's sleep. That better night's sleep will then help with your pain. So what about some assistive technologies, some tools that are out there to help with the pain? I've included a picture here of the TOOLBOX. The TOOLBOX of Assistive Technology is an online database through AgrAbility that includes several different forms of assistive technologies, modified tools, adapted and enabling tools for all forms of different disabilities. There are several in this database that are very pertinent to arthritis pain as well. We're going to go through a couple of those in the next few slides. The first thing you can do when you log on to the internet and go to the AgrAbility website, when you open the toolbox, there's the option to do a search. The best option there is just type in what it is that you're having pain with. I typed in arthritis, for example, on this first page, and it brought up right away two very ideal types of tools or technologies that could help with arthritis pain in the hands. It brings up the bionic gloves and then the faucet or the valve turner. Anyone who's ever tried to turn on a hose nozzle knows that if you have arthritis pain in your hands or you have limited grip strength, turning that nozzle is not always the easiest thing to do. And a very simple, easy tool like this faucet turner that's listed on the toolbox could very easily accomplish that task for you without causing you pain. However, you could also type into that toolbar something like knee pain or lower back pain, and it will bring up different tools that all have those keywords listed in them. And you'll see some of the other options in the next few slides. So you can see here that there's also the option to just explore the toolbox based on the type of activity that might be giving you pain. So if, for example, you work in lawn care and that's where the majority of your pain comes from, or maybe you work with livestock or in heavy machinery, you can search by the type of activity and then it will give you subcategories of what type of tools might be of interest to you. This is really a neat tool for you just to go online and explore to see what type of issues or what type of tools are out there for the issues you're having. Some of these are also great preventative tools. You don't have to have pain or a certain disability to be able to use them, but they're just really helpful to have in everyday life. Here's some examples of things that I pulled up off the toolbox, and I had to limit it to just a few because I could have done several slides of tools that were included that were all beneficial to arthritis pain. But for example, in the category of someone who might have pain or a decreased grip, I came up with these great tools that included things like the spray can tool. Anyone who's ever tried to spray something out of a nozzle type can like spray paint or WD-40, if you have pain in your finger joints and your hand joints, that's very difficult. By adding this pistol grip nozzle to that, you're able to still accomplish the same job, but with less amount of pain in your hands. There are also grips for things that you might have in tubes like cement or different solvents that are hard to pinch or squeeze. The backsaver grip is a picture on the right. The gentleman's using a long-handled rake. And by adding that extra yellow handle, not only is it allowing him to grip at the right angle with the strength of his wrist, but it's allowing him to use that largest joint possible, allowing him to use his shoulders and his backs to move that rake instead of his arms and his elbows. That also helps with the bending or the increased length of tools, which is listed below. There are also some other things that I've listed on here, for example, the leaf gripper yard tongs. Anyone who's ever had to rake leaves and pick them up in a pile or pick sticks up out of your yard or any type of bending activity actually, if you have lower back pain or hip pain, that can be a very difficult job for you to do. They make several different types of tools that allow you to pick things up off the ground without bending, and preventing that movement is going to prevent your pain. There are also long-handled tools like a caulk gun extender if you're applying caulk to any type of job or working in construction and you can't reach the area you're working or you can't bend. And there's also something that we could all probably use right now in Indiana and especially out east, but they have a snowcaster wheeled snow shovel. Anyone who's had to shovel snow knows the extreme amount of pain that can come from that on your lower back and your hips. And by using a snow pusher that's on wheels, it's allowing you to use your entire body weight in your upper body rather than your hips and your shoulders to push those shovels. That's something that we could all take a look into. Again, even if you don't have pain, it could help prevent it. A couple of other categories that I found. Seating aids. Seating is extremely important, and we've done webinars before on just proper seating and ergonomics and posture because that can go a long way towards reducing your overall pain in your body. There's a couple of images here that include things like the Spine Saver ergonomic seat cushion. This is something as simple as what you might even see at an athletic game or going to a high school sporting event where people are sitting on cushions because it's helping with their posture. Now, not just a simple flat cushion, but something that has a bit of an angle to it or more of a wedge is going to put your body in the proper position. There's also casters that will allow you to make your seats swivel in your tractors and other machinery so you're not having to bend and twist your body to get onto those seats. And then in gardening, there's several options of gardening stools and wheeled carts and rocker stools that will allow you to get up off the ground a little bit and prevent you from having to kneel or bend and giving you the chance to sit in the proper posture. Now you can tell the gentleman in the picture on the right is using that cart and his legs are in the proper position, but he's still bending a little bit and he's got some poor posture on his back. However, by having that seat under him, it gives him the option of straightening and resting and stretching his back before he moves on to the next task. There's also carrying aids included in the toolbox. If you have severe pain in your hands, your fingers, your wrists, even your elbows and your shoulders, carrying any object can be very painful. Some of the ones that I found that I thought were interesting were different motorized or automatic feeding carts for livestock, so you're not carrying heavy amounts of feed or water. Automatic watering systems are great. The picture on the right is a LiftMates box lifting tool, and anyone who's ever tried to carry an open cardboard box or even bags of things like rock salt or livestock feed knows that it's very difficult to grab onto something that you have to pinch and that doesn't have a handle. This gives you the option of putting a handle on those items. Very inexpensive tool to be able to use, but it goes a long way towards pain management of the arthritis in those joints. There's also a picture here of the wheeled pump sprayer. Carrying around an empty sprayer container is no problem at all, but once you fill that with whatever pesticide or chemical you might be using, it adds a tremendous amount of weight that you're going to be carrying. If you're carrying that in one hand and spraying with the other, you're severely overusing the joints on one side of your body and not balanced with the joints on the other side of your body. There's also options to putting some of these tanks in backpack type apparatuses and being able to carry them on your back. But I like this version better because it's on a wheeled cart. It allows you to take that sprayer with you everywhere you go, and you're not putting those chemicals too close to your body. So what about after the pain? We've done everything we can to prevent the arthritis pain, or we have taken the opportunity to evaluate our pain and made an appointment to go in and see the physician and say, what do I do now? How do I handle my pain now that it's here? There are several things you can do on a personal level at home that are very low risk that you don't necessarily need an approval from a physician for, but that approval is always best to obtain. But you can try heat and cold treatments on your own. You can try distraction or relaxation techniques even. Maybe moving your mind onto something else. If you know that your knee is starting to hurt pretty badly, maybe finding something else to focus your mind on to take the thought away from that pain. Massage is another option. Massaging the muscles around those joints tends to help relieve pain. And even things like aromatherapy and diet and exercise. But again, those things are going to be different for every person, and you just need to try them and see what might work for you and what might not. However, moving on to probably the one that is the most efficient of those is the application of ice packs or of heating pads. These methods have been used for years, and they're very successful in both relaxing the muscles with the application of heat and reducing swelling or numbing the pain with the application of cold. One thing you do need to remember, however, is that there are certain comfort levels involved. Some people can't handle high levels of heat. Some don't like extreme levels of cold. So the general rule of thumb is 20 minutes for the application of either one, really. 20 minutes of ice or 20 minutes of heat, followed by 15-20 minutes of taking that heat or removing that application away and letting the joints return to normal before applying it again. In some instances, you might need to apply ice for up to 48 hours before the swelling or the pain goes away. And if it hasn't lessened by that point in time, it's probably time to move on to another pain management option. So some general things you can look at from the store and from the physician, and these are things that we are going to cover very quickly because this really needs to be discussed with your physician. This is not something that we can recommend for you, but at least knowing the differences when you go in to talk to them. Some things that they're going to mention to you might be the non-prescription type of drugs or even prescription levels of things like aspirin-free pain relievers. We might know that as Tylenol. That generally only relieves pain. Whereas the non-steroidal anti-inflammatories or NSAIDs like Motrin or Aleve, those actually are going to help attempt to reduce the swelling and alleviate your pain at the same time. There are different topicals like rubs and gels and creams that you can apply, Icy Hot, Bengay, things along that nature. And there's also muscle relaxants and supplements that you can take. But again, these are things that you really need to talk either at least with a pharmacist or your physician before you attempt any of these. You might have a negative reaction to them that we don't want you to have. So what your healthcare provider is going to do is they are either going to recommend that you use a joint support or an aid of some sort. They might recommend that you see a physical or occupational therapist for your pain as well. They could recommend some of those over-the-counter medications that we just talked about, like Tylenol, Aleve, Motrin. They might tell you that you need a prescription level of some of those. There are some options that we'll talk about on the next slide that attack pain a little bit more effectively than the general over-the-counter medications do. They might even suggest to you at some point, if your arthritis has progressed, to think about joint injections with cortisone or even surgery or other alternative options like acupuncture or using some of those supplements. Some of the prescription levels tend to be a little intimidating at times. When a physician says we're going to move you on to a COX-2 inhibitor, it's very easy to get intimidated to say, I don't know what all of this medication is. But what you need to realize is that all medication is basically an analgesic, which just means it's the relief of pain. And some people's bodies react differently to that. So in some instances, a general over-the-counter ibuprofen is enough, or a naproxen. But with others, you might need to move up to that prescription level of a corticosteroid or something like the biologics that we see on the TV commercials now, things like Enbrel, Humira, Celebrex. These are all different types of medications that are going to basically attack your pain a little bit differently. Some of them actually just block the nerves and send the nerve pain issues other places. So, for example, if you move up into a very strong level of prescription with like an opioid, you're going to be working with your doctor on other issues related to side effects and how those are going to affect your body. Again, those are things that we are not going to be able to recommend to you at all in this, just something that you need to talk to your physician about and know that these are not scary options. You just need to make sure you ask the correct questions to find out which is really the best option for you and how is your body going to handle these. So if your doctor does recommend a surgery option, and they say we've worked our way through the medications and the prescription medications trying to figure out what can we do, they might start talking to you about injections or nerve blocks. They tend to work for a few weeks to even a few months, some of them up to a year to take away your pain, but they're temporary. The arthroscopy and synovectomies and joint replacements are much more permanent. They are a little more invasive type of surgeries, but they're also very successful at this point depending on the type of surgery and how your body reacts to those. So those are something that you could talk to your physician about as well. Some of the additional pain relief options come out, and they have great resources for these. This Arthritis Today Supplements is a link that we've provided at the end of this webinar as well, because there are several vitamins and natural options of things that you can take. Several of you have probably heard about glucosamine or osteobiflex, chondroitin sulfate, things like omega-3 fatty acids and fish oils for the anti-inflammatory properties, and even green tea extracts have anti-inflammatory properties as well. Glucosamine and chondroitin are basically both natural substances that are found in the joints of the body. Chondroitin is found in the cartilage of the body, glucosamine as well. Adding the natural supplements in there is not going to fix your arthritis. It's not going to add the cartilage back. However, it can help to make the remaining cartilage healthy. It can help to slow the degeneration of the current cartilage that is in the body. Now, glucosamine has been shown with research to mainly have the most effect in osteoarthritis of the knees, but chondroitin has been shown to have some other effects throughout the other joints in the body as well. But again, some people don't react to them at all. If you do try to take these supplements, if you haven't had any significant change or feeling to your pain in about 6 months, you're probably not going to have any effect or any benefit from those at all, and it's time to try something else. So just please remember that pain does not control you. You can still live a normal everyday life. Enjoy the things that you do every day and find something that you look forward to, because giving yourself a reason to get out and move and be active is reason enough that you want to battle that pain. You don't want it to control your life. Find a way to be active and be productive when you need it, and make sure that whatever you're doing, you're open to the suggestions of your physician or open to looking at some of these resources that we have on this next slide. Go to the Arthritis Foundation website or give them a call. Request some of the free brochures that they have, things like the drug guide and the supplement guide, or even brochures about back pain. AgrAbility has a great new resource on back pain as well that we'll see on the next slide. The American Chronic Pain Association, we have links included on this archive that will give you copies of their Living with Arthritis pain chart and a resource guide to chronic pain, the medications and treatments, and even some new medications that are out there right now currently in research. All of these companies or all of these associations will give you these resources for free. AgrAbility as well has several resources available that you can go onto the website or call our 1-800 number, resources on back pain and general arthritis information, different language resources as well that we are certainly willing to help and share with you. In addition to that toolbox resource that we worked through, click on this website that's included on this slide and just spend some time exploring the different tools and assistive technologies that can really help you with your pain management from your arthritis. So with that, I think I am going to say thank you very much for joining us today. I'm going to turn it back over to Paul, and he's going to open it up for some question and answers.
Thank you very much, Amber. A lot of good information there. At this point, we're going to ask you a couple of poll questions, but I also invite you to put any of your questions into the chat window in regard to things that you heard during the presentation that you weren't sure about or that you would like to have more information about. Also, I would point out at the top, we do have the link for the archive of this webinar and those fact sheets that Amber talked about, and links to some of those guides are available on that page. Before I forget, I also want to point out that our next online training event will be our annual web conference on December 2 through 4. And we will be planning to have 6 webinars over a 3-day period. You can go to the link listed on your screen there and find out more information about specifically what sessions are going to be involved and also about how to register. So we would invite you to do that. Our first poll question, we would just like to get your feedback in terms of where you're coming from in regard to your organizational status. If you look for a particular type of organization, and again, if you are an AgrAbility staff member, we ask you to check that one, and if not, the most appropriate. We realize that many people may be in several different categories, but please pick the one that's most appropriate for you. Okay, looks like we've got a pretty good range of different people, from AgrAbility to consumers to people working with various health and disability-related organizations. Our next question asks if the information that you received today was valuable and whether it met your expectations or not. We would invite specific comments if you would like to make those too in the chat window or through email. One other note while I'm thinking about it, if you had multiple people at your site and you only listed one when you logged in, if you could let us know that, that would help us to be able to most accurately keep track of our attendance. Okay, looks like people seem to get the right information that they were looking for today. Appreciate your feedback on that. Our third poll question asks about the technology. If you had any issues, if it was usable for you today. If you had specific problems, we would appreciate you letting us know in the chat window so that we can possibly troubleshoot those as best we can for the future. Okay. Thank you for your feedback. Looks like generally people got along okay. A couple of problems, and again, please let us know if there's specifics that we could try to remedy there. I know one person was having difficulty with sound. Finally, our last question. Based on today's session, would you attend another session in this series? Okay, again, thank you for your feedback on that. At this point, I'm going to turn things over to Amber again, and I believe we do have some questions that have been asked. So I will mute my microphone.
All right, thank you, Paul. Well, it looks like I see two different questions here, and we'll try to address both of them. The first question is, what does a synovectomy involve? That's one of the surgical options that I mentioned along with arthroscopy before we get to a full joint replacement. Synovectomy basically involves removing the synovial fluid, which is the sac of fluid that's in around a joint and around the bones that form a joint. This becomes inflamed during arthritis, especially with rheumatoid arthritis, causing a lot of heat, warmth, swelling, and pain. By removing that synovial fluid and inserting a type of synthetic fluid, it allows that joint to be a little more mobile without the pain. However, it's not permanent. The synovial fluid can come back because it is a naturally occurring substance in the body, and when it returns to that specific joint, there's the option, or the chance that that pain is going to return again with that synovial fluid as well. So if you think about a joint and go back and look through at that picture of the joint, you'll notice that it's formed of the two different ends of the bones, and before they meet, there is a layer of cartilage that separates the two, and then that is surrounded by a fluid-filled sac, which is the synovial fluid. When that fluid gets inflamed, it affects every part of that joint, the cartilage inside the synovial fluid and both ends of that bones. So the synovectomy just basically means that they are removing that inflamed synovial fluid and replacing it with a synthetic version that's going to still protect and fluidize the joint, but it's not permanent. So I hope that answers that question. The next question I see is, has there been any scientific research into the natural vitamins or supplements to document if they really work or not? The answer to that is yes and no. For some of the supplements like glucosamine and chondroitin sulfate, yes, there is extensive research out there. However, all of the research tends to still be a bit insubstantial. There have been research relationships showing that yes, they do have a significant impact on pain relief and managing arthritis pain. The problem that they're trying to solve now is finding out really specifically what joints do those supplements work best with. So for example, I mentioned that it has been found now that glucosamine tends to work best with osteoarthritis of the knees, and that's where it's most effective, but it's still not the most effective version of pain management. The chondroitin, some research is showing that it works only best in partnership with the glucosamine, and others are showing that it works best on its own. So there is research out there. They have been proven to be safe by the FDA. The Arthritis Foundation does support the use of those. However, the research is still ongoing. Now, when you get into some of the additional supplements and natural vitamins, things that I mentioned like the green tea, the omega-3 fatty acids, the fish oils and things like that, there is research available to show in the documentation that those are beneficial for pain relief as well. But most of the research there is just simply stating that they are a safe alternative. They're a natural method that has been shown to relieve pain in certain cases, but it's certainly not going to be a permanent fix for any type of severe pain related to arthritis. If you go to the archive and click on the link of the Arthritis Foundation's drug guide and the supplement resource guide, it will give you each of those individual natural vitamins and supplements, a description of them, what type of pain relief they can give you, what specific joints they might work with, as well as where they might be in that research process. The other thing you can do is go to the Arthritis Foundation's website at arthritis.org, and there's a link that specifically says research, and it will bring up all of the current research that's happening right now related to all forms of arthritis, whether it's osteo or rheumatoid or fibromyalgia, and it will give you some of the updated medications that are also in development. There's also I believe, a PDF file that's going to be attached to this presentation on specific medications that are being researched right now that might help. So I hope that answers Ned's question as well. And do we have any other questions? It looks like we have some being typed. Maybe not. Okay, well, I don't see any other questions popping up onto the screen. Again, if you have any questions after this presentation, please go back and review some of those resources and links that we've provided, but also take a look at the last slide of this presentation. It provides you with all of my contact information. I'm happy to talk with you by phone or email and answer any questions you might have in addition to what we've provided you today. So thank you and have a great Tuesday afternoon.